Hello everybody, welcome back to my channel. My name is Pinky. I'm an advanced pharmacist clinical practitioner. Today I have decided to make a video on erectile dysfunction, which is a very common problem in men. Okay, so as you all know that my scope of practice is diabetes, and one of the question which I ask patient in my diabetes review is, do you have erectile dysfunction? And as it's a very common condition, that's why I'm going to explain you and help you to understand about erectile dysfunction. I'm going to explain you how I take a history for erectile dysfunction, what are the examination parameters, how I'm going to investigate erectile dysfunction, when I'm going to refer the patient to the hospital or to secondary care, what are the treatment options available. And whoever watches my video regularly knows that I always tend to follow the guidelines. It's very important. So basically how I'm going to take the history for erectile dysfunction. So what is erectile dysfunction? Erectile dysfunction is something where there is like persistent inability to maintain erection which is required to have sex. Okay, men, they lose that ability to maintain erection. Okay, so in order to take the history for erectile dysfunction, I'll definitely ask like, what is the strength of the erection? Is it mild, moderate, severe? What kind of problem is it? Okay, so what is the strength of the erection? Number one, do you live alone or do you have a partner, or is it a long-term condition? Okay, sex is important to ask about. So regarding sex, if there is any desire to have sex, orgasm, is there any pain, relationship, sexual preference, current relationship, any history of sexual abuse in the past, partner factors, again desirable, pain, how is the relationship, if the female partner had past history of pregnancy, childbirth, menopause. Social cultural factors are important as well. Family history, social history, religious beliefs, then physical health, so for example diabetes, thyroid function problem, then hormone levels in the body, then if there is any symptoms of a hormone called prolactinoma, headaches, visual disturbance. Other factors such as drugs such as beta blockers, for example bisoprolol, diuretics such as furosemide, verapamil, digoxin. There are some drugs which are responsible for erectile dysfunction. Then sedating drugs which makes a patient sleepy, okay, and antidepressants such as SSRIs like serotonin. I have discussed about serotonin in my previous video. Amitriptyline, which is a tricyclic antidepressants, and any kind of hormonal problems can be a factor as well. And alcohol, smoking, recreational drugs, there are men who abuse drugs, and obviously increasing age, lifestyle which is not very active, and cycling more than 3. So in order to investigate erectile dysfunction, I'm going to go for some investigations such as full cholesterol test, then diabetes screening. I'm going to go for a test called HbA1c, as well as the glucose, the sugar level test, then the testosterone level test. Testosterone, it has to be done very early in the morning. The patient can't have any food before having the test. And if the testosterone level is abnormal, then I'm going to go for another 2 tests called luteinizing hormone and follicular stimulating hormone. These 2 hormones, I'm going to test those 2 hormones. And then prolactin test can be done. Thyroid function test is sometimes very important to carry out as well as prostate specific antigen test in elderly men. Let's talk about the most important bit, that is the treatment. So obviously we need to treat things like, obviously, say for example, lifestyle, stop smoking, reduce your alcohol intake, be active, half an hour activities every day, then pelvic floor exercises. If there is any modifiable factors that can be reversed, you need to work on it. So medications, very common medications, sildenafil. Sildenafil, you can buy it over the counter. Sildenafil belongs to a class called phosphodiesterase type 5 inhibitors. There are different medications under this class, such as sildenafil, Avanafil, Vardenafil, Tadalafil. I'm going to discuss about how to take these medications, okay, in quite detail, and what is their half-life. So how to take medications to help with erectile dysfunction. It is very important, the timing before sex. The timing before sex, okay? The timing matters. Now, sexual stimulation is still required to have erection. If it is best taken, if it is taken in empty stomach, it may not work like as well. Onset of action may be delayed, especially with fatty food, okay? Avoid excessive alcohol, as this decreases erections. Grapefruit juice should be avoided as well because it interacts with medications. Now, sildenafil, start dose 1 hour before expected sexual activity, half-life is 4 hours. Avanafil, start dose 15 to 30 minutes before expected. So as we are talking about Avanafil start dose 15 to 30 minutes before expected sexual activity, half-life is 6 to 17 hours. Vardenafil, another medication, start dose to immediately take 20, so basically take it 25 to 60 minutes before expected sexual activity, half-life is 4 hours. Tadalafil, start dose like at least 30 minutes before expected sexual activity, half-life is 17.5 hours. And what are the side effects of these medications? There can be flushing, nausea, dizziness, vomiting, back pain, less common chest pain as if the heart is racing faster, tinnitus, dizziness, again vertigo, painful red eyes. So I always encourage my patient to read the patient information leaflet before using any medication. Now, there are some medications, say for example like any nitrites like isosorbide, mononitride, isosorbide, dinitride, glycerol trinitrate spray, amyl nitrate poppers, or nicorandil. The medications for erectile dysfunction like the sildenafil, Avanafil, Vardenafil, Tadalafil, they are highly contraindicated. They should not be taken together. And all erectile dysfunction medication, they cause a small drop in blood pressure, okay, and in combination with certain medications it can be very dangerous, so you need to keep that in mind and then take this medication. So read the patient information leaflet, think, is it safe for you? So I have covered everything as per the guideline, okay. How to treat erectile dysfunction. I hope this video will help you immensely. If you have any questions, put in the comment section below. I'll try to answer. I don't provide any online consultation, unfortunately. Like my Facebook page, do like, share and subscribe my channel. Thanks a lot for watching. Stay safe. Goodbye.